Hi everyone, thanks so much for joining us again. We're going to be switching gears today to talk about cancer prevention awareness, screenings, and follow-ups because the 1st of February actually marked the beginning of Gulf Cancer Awareness Week. Now, I know that for some of you, this topic is a trigger because you've experienced the loss of a loved one, you're going through cancer treatment currently, or watching someone that you love go through treatment. With all of you, we stand in solidarity and support. Some of you might be thinking, well, I'm young, I'm healthy, I have no family history of cancer. What am I doing here? And to you, I say, please stick around. What you don't realize is that not all cancers are inherited. And there are factors such as your environmental stressors, your lifestyle, and subtle changes in your health over time that may increase your risk. Now, we're not trying to scare anyone with this video, quite the opposite actually. We're trying to alleviate the stress around cancer by letting you know that modern medicine has allowed for us to have some fail-safes in place to be able to catch things before they start, or at least catch them early enough in the process where if, God forbid, you were to get treatment or you had to get treatment, you would have more simpler, effective treatment. Let's just jump right into it and talk about screenings. Screenings aren't meant to be feared. I would rather that you think of them as a routine health checkup. So go to your doctor and say to him or her, this is my health profile, this is my family history, what kind of screenings do you recommend and how often do I need to do them? Now, you need to know as well that not all screenings are a one-size-fits-all. So remember to give your doctor as much accurate information about your medical history and your current health as you can so they can make the appropriate recommendations tailored specifically for you. Now, when they're putting in these screens, you need to ask them by when you're going to hear back. Could be 24 to 48 hours, could be 7 to 10 days, could be 14 days, it doesn't matter. But knowing that timeline is really, really important because the last thing we need is for a result to fall through the cracks. And it does happen because doctors and nurses are human and human error occurs. So what we don't want happening is for someone to become symptomatic, say in about 8 to 10 months down the line, when we could have actually caught it ahead of time. So take control of your own health, follow up, and be proactive. The last thing I want to talk about on this video is awareness. And by this I mean awareness of your own body. We all look in the mirror every day. And if you tell me that you don't, I'm not very likely to believe you. But you know your aches, pinches, and pains. You know what happens to your muscles when you go and lift weights. You know what your thirst signals are, your hunger signals, your sleep signals. You know what happens to you specifically if you drink coffee too late at night or you don't get a good night's sleep. I, for one, wake up the next morning with a headache. So I want you to recognize all of these body patterns and call them your baseline, right? And now, when you have irregularities over that baseline is when you need to sort of raise the red flag. Let me give you an example or some examples. Unexplained weight loss or fatigue. So your activity levels haven't increased significantly. You're not trying to change your diet, which would result in weight loss, but your pants are still falling off. So what's happening there? For men, if there is an obstruction in your urine flow, what's going on? If you experience any unexplained lumps or swelling, and the other one that I could think of off the top of my head is bowel movements and bleeding in your stools. If you have any of these symptoms or anything that is not normal for your baseline, I urge you to please, please, please go get checked out. That's what doctors are there for. That's why we have insurance. And just as a side note, the UAE government and the place that we live is absolutely wonderful because they actually launch cancer screening initiatives intermittently throughout the year for different types of cancer. Insurance companies as well, depending on your network and your policy, of course, will approve certain screens. So give them a call and see what's available to you. If you don't know where to start, we would recommend starting with your primary care physician, or you can always reach out to us. Our contact information is below in the description. And if you feel like this video has resonated with you, or it made you think of a family member, a friend, or a colleague, send it to them subtly, and also let them know that if they need to go get checked out and they're afraid to do so, that you will support them, and ask them if you can accompany them. We're always here to assist and point you in the right direction. Thank you for watching, and we'll see you next week.